Welcome everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 34 new cases of COVID-19 in Windsor and Essex County. Of the 34 cases, 5 are outbreak related, 12 are close contacts of confirmed cases, 11 are community acquired, and 6 are still being investigated. We have had 12,899 cases since March of last year. 12,261 cases are now resolved, and 260 people are active at this time. 47 confirmed cases are currently in the hospital, and 4 people are in ICU. Our community has lost 378 people to COVID. We are reporting 2 additional deaths today. Both people are from the community, a man in his 50s and a woman in her 80s. 236 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 12 active outbreaks in Windsor and Essex County, 4 in long-term care and retirement homes, 2 in community outbreaks, 4 workplace outbreaks, and 2 hospital outbreaks. We are currently in phase 1 of Ontario's 3-phase COVID-19 vaccine distribution plan. 11,511 people from Windsor-Essex County have now received both doses of COVID vaccine. The recent decision by the provincial government to include adults 80 years of age and older in phase 1 of Ontario's vaccination plan has significant implications for our region. With over 20,000 residents in this age group living in Windsor and Essex County, we know that vaccination is a safe and effective measure in the fight against COVID-19. So it is with great pleasure and excitement that we announce that we are moving forward with vaccinating Windsor-Essex seniors 80 years of age and older beginning Monday, March 1st. We have been working closely with our municipal partners who are all committed to supporting these targeted appointment-based vaccine clinics for our 80-plus seniors. Beginning Monday, March 1st at the WFCU Centre in Windsor, and on Monday, March 8th at the Nature Fresh Farms Recreation Centre in Leamington. So we'll start with those 2 clinics. Scheduled appointments at each of these sites will occur Monday to Friday, typically between 9 and 4. And we will continue with this targeted age group of people over 80 years based on our vaccine supply. In order to ensure the most efficient and equitable registration process for our seniors, we've developed an approach that includes a pre-registration system, which will be available later today. And we're going to use our media partners to, through a media release, to share more details. And there will be information on our website. So while we encourage as many residents as possible over 80 years of age to work with their friends and family to access our website to complete this pre-registration, we recognize that that may be very challenging. So we also will have another means to access our online system, and it will be through a phone number hotline. And that will be available this afternoon as well. So all of these pieces are constantly changing and being ready for the launch this afternoon. The phone number will be on our website, so for those people that can't pre-register online, they will be able to call the phone line, and recognizing that there will probably be a wait period. We will be posting the number on our website, in the media, on our mailing list, social platforms. So we just want to reassure our residents that there's no need to rush to be the first person to actually submit to pre-register or to call in. The pre-registration is not a first come, first serve system, and those who pre-register will be added to a list of all of the registrants who will that are over 80, who will then be randomly selected and contacted by us for their appointment time. So we will be contacting people based on the amount of vaccine we have in the available space at upcoming clinics. So, there's not a rush to, register right this minute. Anyone who does not meet the criteria will not be offered an appointment, and we will not be taking walk-ins at the site. This is very targeted for our seniors only, 80 plus, and we'll be closely monitoring this. More information on all of this will be released later today through the media release, and we do still encourage all of our residents to visit our vaccine webpage for information at wechu.org and click on the COVID-19 vaccine button. So despite even moving forward with the vaccine rollout, everyone must continue with public health measures, staying home if you're sick, limiting your close contacts to household members, maintaining that 2-meter distance from others, washing your hands often with soap and water or an alcohol-based hand sanitizer, wearing a non-medical mask or face covering, covering your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze, and downloading the COVID Alert app at canada.ca. So that's our big news for the day, and I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning, and thank you for joining us. I think after sharing that big news, I don't have anything more to add. We'll look forward to continue to roll out the vaccine as quickly as possible. And the only point that I would add is we have to recognize that we still have limited supply of vaccine, and we're doing our best to make the best use of the available vaccine to vaccinate. It would be a lengthy process, so I want to remind the resident that it will not happen in a week time or in a 2 weeks time. It may take us a little bit longer given we have limited supply of vaccine. But what we are already committed to is to make sure that everyone in that priority group, they will get the vaccine before we move on to the next priority group. So that's the work that will continue to happen, and we'll continue to do everything to keep our community safe. But just be patient with us and just continue to work with us to get it rolled out as soon as possible. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Hi, good morning. I'm wondering if you can say exactly how many people you expect to vaccinate based on the current supply in the 80 plus category.
So it's a very good question. So right now we have very limited vaccine. So we're going to, on the first day, I would think we're going to be doing maybe only 150 people and up to 200 people a day. As we move into the Leamington site as well, we'll further have to share our vaccine allocation, but that's why we're just doing a 5-day-a-week process right now, because we'll go through our vaccine quickly. But we think this will be manageable. It is a targeted group. We want our seniors to not be rushed through this process, but so it's not the mass immunization clinics that we're talking about in phase 3, where everyone's able to access the vaccine. So there are limited supplies. That's not a big number. Typically, we would be doing these groups, in smaller clinics, and that essentially is what it is. But we are excited to roll out what we have, and give it to the most vulnerable. So it'll be smaller numbers, but it's still getting to the right people.
And the registration system, this is totally separate from the provincial registration that we heard an announcement about yesterday. That's not coming for another several weeks. Will we be the first jurisdiction in the province to offer vaccine to this age group?
We could very well be the first. I know that we're in conversations with other health units and on ministry calls, and I cannot confirm, but I think this will be pretty significant in Ontario, because I believe we'll, if not the first, close to the first.
Okay, thank you.
Any questions from Blackburn?
Yes, good morning. I just wanted to ask, with 20,000 seniors estimated across the region, if you're giving out up to 200 shots a day, that's 1,000 a week. It could take 20 weeks. I guess this is in 2 parts. What is the next priority group, and when do you plan to move on to them? You're not going to wait 20 weeks, I imagine.
So I'll respond to that question. So we, under the provincial sequencing, the immediate priorities that was identified was the staff and essential caregivers in long-term care home, retirement home, resident staff. So all of those are, we have done all the reasonable efforts to get them vaccinated. So that part is done. We are also now working on the healthcare worker population, that work is still ongoing. So there are a number of different criteria for healthcare workers. So that is ongoing. And we, as we mentioned, I believe a couple of days ago, that we launched the portal for registration for a very high priority healthcare worker in the community. And that work is ongoing. The next priority in the list is obviously, touching on the adults 80 years of age and older, and then the remainder staff, residents and caregivers in the other congregate settings, healthcare worker in other priorities that was not already identified, as well as all Indigenous adults and the adult recipients of chronic home care. So we're trying to connect with some of these adult recipients of chronic home care as well, because a lot of them are also in the 80+ category. So we are trying to use a blended model to get some of those individuals captured in the 80+ category. And this is the supply we are talking about it right now, and this is the number that we are saying that we are able to offer a day, recognizing that these seniors will take a little bit longer to make the assessment, ask question, and make this experience a very good experience for them, rather than rushing them in, as Teresa mentioned. So we want to make sure that we are giving them enough time. But let's say as the process improves and we feel that, well, maybe we can do more, and if we get the indication that we have more vaccine than what we need, that can ramp up to as much as possible. So even having 2 sites, one in the county and one in the city, would allow us to distribute a significant number of vaccine per day if we need to ramp up. So I'm not anticipating that this should take us 20 weeks. I'm anticipating that if the vaccine supply starts to increase, let's say late March, early April, we should be able to complete all this priority group, because as we know, almost 2/3 of our death in this region happen in the 80+ population. So that's a significant number that we are trying to save lives, and we'll continue to do the rest of the priority. As soon as we have done a reasonable amount of work in this area, we'll move on to all the other remaining priority. We have a local prioritization group as well that is working to continue to review these evidence and then the direction from the province, and work together to come to some recommendations for the broader vaccine task force and to us. So all of those things are being incorporated. It's the only limitation or limiting factor right now for us is the supply of the vaccine. If the province wants to give us more vaccine tomorrow, our system is ready to handle that. We can ramp it up to as many vaccine as possible, up to 600, 800 doses a day if need be. But again, this is what we are trying to do given the limited supply that we have, and also make an effort to save lives, especially in the age group that is affected the most in the region.
I know the provincial announcement yesterday said that after 80+, it would be 75, then 70, then 65. Is that kind of how the health unit will also prioritize seniors that are under 80?
So there's a lot of work that's happening in that area. So one, you can say that there is a prioritized group identified based on different factors. One of the factor is age, and then the other factors that is identified based on their living arrangement and any other factors, such as, when I talked about the other congregate care setting, we talked about the Indigenous population, we talked about the adult recipients of chronic home care, then we talk about some of the other priority neighborhoods region. So there is almost like a parallel process that I can envision that on one process, this will be all the identified priority group that is outside of the age bracket, and then another parallel process where we continue to work with the age-based bracket, because we know the only single predictor for developing any severe outcome with COVID is age. That's the most easiest and simple answer that we have seen. So we want to make sure that we are not missing out on any of these opportunity and maximizing our resources. So as we move on, I see a parallel process. We'll see the age base working as well as the other prioritized group working in conjunction with each other to maximize the reach.
And at this point, it looks like that could be maybe after the start of early April?
That's what we have the numbers and the indication that when vaccine supply will increase, but it can change. We know that there are other vaccines that are currently being reviewed by Health Canada, and if approved, there may be more availability of vaccine in other other type, like such as AstraZeneca or other vaccine, which may be more easier to mobilize and to distribute. So we want to be ready as the region by having all of these things in place. We've got an amazing partnership with our Windsor Regional Hospital, and we had this initial site running since mid of December. That really gave us the opportunity to be at the front of the administering and delivering vaccine, and combined with the efforts that the Windsor Regional Hospital is doing, as well as our public health teams are doing, we are making a lot of progress, and we'll continue to make a lot of progress. We are also working with our other partners, the primary care providers, the pharmacists, to get them vaccinated, to help them to help us mobilize the vaccine rollout in the region if need be. So we are trying to leverage all the possible existing resources that we have in the system, as well as build new resources to roll out the vaccine. So Teresa and the team has done an amazing job in pulling all of this in the clinic together in such a short period of time. And probably we will be the first region in the province to roll out the vaccine for 80+.
Okay, thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Do you expect to be done vaccinating the roughly 6,000 healthcare workers before Monday, or like you said, will it be a parallel process where that vaccination continues as you begin to vaccinate the 80+?
So it would be a parallel process, Taylor, and so we are looking at all of that information and data, and as I said, it's an estimate. We'll have to look at what this actually translate into the numbers, but we want to make sure that both processes can operate at the same time.
And who will be administering these vaccines at both centers? Is it public health nurses?
Yes, so our public health nurses will be doing the 80+ vaccinations. And also just for the seniors, 80+ wanting to, pre-register or get prepared as we send out the media release, they will be asked for their first and last name, their date of birth, their address, their health card number, and also the preferred phone number. So I just want people to be aware of what we will be asking in the pre-registration form and on the call if they're calling in. So just to add that as well.
Okay, and you mentioned this yesterday, but to reiterate, this is for people right now who are able to get to those facilities on their own, and the health unit will come up with more accessible ways to vaccinate this population later. Is that still the case?
We will continue to work on other methods of access or strategies for access, and that will likely involve moving, our teams and others that we're partnering with moving into areas where there are, populations of seniors living. So we'll work on that as well. But right now you're absolutely right. It'll be the people that are able to get to the clinic, and we hope that the experience at the clinic will be, reasonable and acceptable and a good experience for them. But there will be other opportunities or other strategies that we have to keep considering as we get more vaccines and be able to transport the vaccine safely and all of those issues as well. So right now, this is one way to access the vaccine over 80, but we will be working on other strategies. So this isn't the only opportunity. As Dr. Ahmed said, our intention, our commitment is to get everyone over 80 that wants the vaccine to make sure that they have access to the vaccine. So it certainly is not only at a site in Windsor or a site in Leamington.
And with this addition of one and then another center where this group can be vaccinated, when do you expect that the region will run out of vaccines, and will we receive more before that happens?
So right now, we have not received our Moderna vaccine other than the 2 shipments we received, so far. One at the end of 2020, and then again in one in 2021. And so we are sharing our allotment, but with, for our region, it's with Windsor Regional Hospital and our health unit. So we are using the weekly supply that is provided for Pfizer. So the vaccine that we're using right now is Pfizer until there is the ability to have more supply or another vaccine like Moderna. So if we were to receive more vaccine that we can transport out more easily, like Moderna was, then we would probably start moving into those other, other strategies as well. But right now we don't have that.
Do you know
Sorry,
go ahead.
I said right now we don't have that. We have a very limited supply coming to our area. And as Dr. Ahmed said, we are ahead of other health units. And as you probably recall, we were a pilot test for the long-term care homes. So it did give us a couple weeks advance immunization in our community. So other health units have not had that, that ability, and they're rolling out the vaccine. So we're taking the share that we're given, and we're, putting it to good use as we can.
Do you know if Windsor Regional Hospital will receive more doses of the Pfizer vaccine before it runs out of its supply that it's sharing?
I think between Windsor Regional and our health unit, we've got our, we talk every couple days to make sure we're on the same page and have a good understanding of the vaccine prioritization, but also the supply of the vaccine. So right now we are getting it delivered in smaller amounts, and we're both monitoring what that would look like. So if the supply is not much. If we're, if I'm talking about, 2,000 doses for the seniors in a week. So if the focus is about 200 people a day, that's probably more than what we're going to be doing. But 200 a day, there's only 1,000 doses allocated to Windsor, and then 1,000 will be in the county. And that's kind of what we're working with right now. And that's more than what we have. But we also will have to, make sure that there's enough for second doses. So we have an inventory, we have people managing and watching all of that to make sure that if there is some delay or that we have enough held back to make sure we have second doses to give to those that are getting first doses. So that's the other thing with the seniors. Ideally in the, it would have been nice to have seniors be able to go to their family practitioner and other, opportunities, because they will have to return for a second dose. The series is not complete with just one dose. So with Pfizer, it's 21 to 27 days or a little bit longer, but we will be having people return to the site for their second dose right now as well. So we're managing all of that, but there's not a lot of vaccine right now, so there's not a lot to, not a lot to manage.
Thank you.
Any questions from AM 800?
Teresa, how will it work out? Is there a giant map, and residents from Windsor won't be going out to the Leamington or vice versa, or it will be split up? How is it going to be worked out?
So as people pre-register, it'll be this random process. And so they will have to give their address, and we want to service exclusively people from Windsor and Essex County. It can't be outside of our area. And so as they register, wherever the openings will be, they'll be offered an appointment. So if they, when they call in, and they'll be speaking to someone for the appointment. So they pre-register. If they're selected, then we're calling them to book the appointment and let them know. So that'll be managed at that end. We are using a call service to help with all of that. And so right now, you're right, people in the county right now, they may not want to pre-register for this city opportunity, or they may, but we only have 2 locations at this time, and those are the only options. So if it's not doable, then people won't, they won't take us up on that appointment. They'll say, oh, that's not going to work for me. We hope that as there is, more vaccine comes, and, potentially healthcare providers, pharmacists, that there will be more access for all of our residents. So this is a plan that's in place with the limited amount of vaccine we have, and trying to, roll it out in a way that we can get people to return for the second dose as well.
I know you mentioned don't rush to the site, but if people do rush to the site, can the server at the health unit handle this, or do you anticipate some delays? So
our IT have been working so hard. Everyone has been working so hard on this, and we anticipate that everything is in place. But I have learned not to say everything will work smoothly. There are so many quick changes throughout this whole pandemic, but there has been a lot of preparation. And this solution, this pre-registration, is not our final solution. It is being used for this specific target right now. And I know the province has another pre-registration form, and we were just a little bit ahead of the province. So we created this this method, and we hope it all works. And I'm looking at Mike, but we're all working hard, and our IT staff have been testing everything. So we will see. We will see. I know the phone lines will be quite busy as well, and we do have lots of people answering them. But I do anticipate a wait time for anyone who's calling on the phone.
Yeah. So.
Before in
so Rob, can I just?
Sorry, Dr.
Yeah, can I just want to add to what Teresa said, and I think I want to make sure that we recognize that the province still hasn't released their system, and I want to acknowledge the work of our staff there to pull it all together, and maybe they can blame it on me to pushing them to get all of this work done in time to start vaccinating. We have been working every day, and our staff have been really amazing to pull all this together in such a short period of time and making sure that it works. And we're truly hoping that it would be a good opportunity for our residents, but I want to acknowledge the amount of work that has gone into behind the scene to make it all happen. Not having a system beforehand from the province or any other area, it does require a lot of effort, and our team really is amazing to pull it all together. Our partners have been really great in working with us to make sure that we get to their place. So I just want to reiterate that it's not to be taken lightly. It is a lot of work that happened behind the scene, and I truly want to acknowledge each and every member of my team who has been working pretty much nonstop to make sure that we have the system ready to go.
You answered my next question. That's what I was going to say. I know I asked this before, but obviously here in Windsor-Essex, the local health unit and your partners, a lot has been accomplished, and a lot of firsts in the province. It seems like we're kicking some butt here, and like you said, it's just some good news. So thank you. You answered my question. Thank you.
Any questions from CTV?
Yes, I'm just wondering, how is Windsor-Essex able to be first or one of the first since we're not considered a hotspot anymore?
So I'll start first and then I'll pass it on to Teresa. So I think what we are talking about is two different issues. It's not an initiative from the province. I think the province obviously has given us the direction. The vaccine allocation, we haven't seen an increase in the vaccine allocation. So the vaccine allocation that's been coming to us, it's pretty much the same since January. In fact, we have seen some reduction, which was pretty much everywhere. But other than that, we haven't seen an increase. So we're doing okay in that sense. But just because we started receiving the vaccine early, we were able to complete some of these other priority population in a timely manner. We've been very careful in how we are using and maximizing all these vaccines to get to the right people. So I won't say that it's the hotspot status that is getting us the vaccine. I think it's the vaccine allocation is the same, and the good work of all the partners and everyone and my team to pull it all together. It's been nonstop, and I don't want to belabor the point, but we've been working really hard for our community, and we will continue to do that. That's our goal. That's our motivation, and that's what's driving us. We want to make sure that we are doing everything in our power to keep our residents safe, to protect our most vulnerable in the community in the most equitable, in the most efficient manner. Maybe at times it may not seem that we are not touching on one priority versus the other. There's a lot of thought and rationale goes behind each and every decision that we make. There's a whole systematic process that we follow. There's a whole lot of expertise that goes behind in all of these decisions. So while maybe it seems that some of these decisions are not well thought out, these are all well thought out decisions, and there's a lot of amount of work and energy goes into making all of this happen.
Okay, and why are nurses who live in Windsor but work in Detroit not allowed to volunteer in the vaccine rollout?
So since the beginning of this pandemic, our recommendation has been very clear. If you are a healthcare provider who are crossing border, which is in for any other normal individuals, right now that is closed. The border is open only for the essential worker. And for those essential workers, if they're crossing the border, my recommendation is for most of them to do the work home self-isolation. They are not supposed to be outside in mixing in with all the rest of the population just because of the border issue and the quarantine issue. This is an important consideration when we are making some of these recommendations. We recognize, we value their importance of providing healthcare services, but we also want to make sure that we are also following some of the key recommendations to ensure the safety and well-being of our residents. So while I cannot speak specifically to any individual situation, but our broader guidelines have always been clear. We have asked the healthcare worker to work on one side of the border, and if they're crossing the border and going to work in US, they are to maintain their work home self-isolation as best as possible instead of attending any different health services or location across the border.
Does this make a difference if they've already been fully vaccinated?
Well, the Canadian guidelines does not differentiate if you're vaccinated that you are not allowed, that you don't need to quarantine or you don't need to take precautions. Everyone in Canada, according to our Canadian guidelines, they have to follow all the guidelines, they have to follow all the recommendations, including all the quarantine requirement.
Okay, thank you.
Any further questions from CBC?
Yes, I wanted to ask about the increase in cases connected to the Salvation Army outbreak in particular. Do you have any updates to share about the situation? And I'm also wondering if the health unit has considered a similar order to the one put in place with the mission.
So, no, we haven't considered the similar order that we have for the mission because of how Salvation Army is structured and their ability to implement some of these outbreak control measures. So they are doing that, and that's why it's critical that we continue to keep it safe this way. We provided that updated number yesterday, and that number hasn't changed, at least for me now. My team will work on those numbers and maybe will provide a later update for me in the afternoon that we can share tomorrow. At this time, I don't have any additional number, but the whole reason is the layout and the structure that is in place for the mission, as well as the Salvation Army, is completely different, and their ability to implement all these outbreak control measures is completely different, and that's why we haven't issued any order specific to Salvation Army at this time.
Thank you. And so could guests of that facility be moved to the aquatic center at all, or are they all staying put?
So at this time, I don't want to share all those details because that's still a work in progress. We are working with all our health system partners to have the new facility up and running, and to identify that facility as a facility that is keeping all the negatives on site and providing them the support that they need. And the rest of the details are currently being worked out, so I don't want to preempt that, but some of those conversations are happening. It's not to say that they won't be moved, but I don't want to say that everyone will be moved. So it'll be a discussion, and it will be a risk prioritization to make sure that we are following the cohorting principles and not putting anyone at risk.
Thank you.
Any further questions from Blackburn?
Yes, I wanted to know why are you assigning people appointments randomly and not first come, first serve?
Well, we recognize that it's an equity issue, and not everyone will have an access to an internet, and not everyone will have an access to get in the queue to register by phone. So removing that equity barrier, we feel that it's important that we give equal opportunity for everyone. And when we have that list, we can randomly take out the sample and assign it. As Teresa mentioned, rest assured, our plan is to vaccinate everyone. We are not moving forward until we offer a vaccine to everyone who needs it in that age group. So we'll continue to work with it. Yes, maybe you may have an opportunity to be the first one to receive the vaccine, or unfortunately, you may be in a position that you are the last one to receive the vaccine. But we want to assure you that we will get to you as quickly as possible and as efficiently as possible, and in a very equitable and fair way.
The other question I have is, on the same day yesterday that we talked a bit about this, and you mentioned you were going to have the plan today, the province came down with its plan. Now, I know it doesn't take effect till March 15th, but are you afraid that that could cause some confusion?
Well, I think that's why it is difficult for all of us because even in the province, every health unit is at a different stage and different priority that they're serving right now. I tend to focus on what my community needs are and whether do I have the authority and ability to administer or to do what is needed for my community. So we'll continue to do that, and the province hasn't like, and I'll just be honest with you, the province hasn't said that that you shall not do this versus you shall not do that. They have been supportive. It's all about the ability for us to do all of that work. And also wherever they can support, they have provided us with the support, but the province has a much bigger job to do. My job is relatively simple. My focus is Windsor-Essex. Their focus is everywhere, and some areas have received more vaccine than the other. Some areas are still starting to vaccinate their highest priority homes and congregate setting. So we are at a different stages. I would say that with our daily broadcast and everything, we want to make sure that the community is aware of what is happening locally, what are our local issues, and stay focused on that rather than what the province is doing for everyone in the region. Everyone in the province.
I'm thinking more about the seniors that you're targeting, whether they will be confused.
Well, I hope they should not, because we are hoping that through all the news media outlet and local communication that we are doing in the region should help them understand that this is for them. We are taking that leap. We are doing all of that work to provide them with the best care possible in the region, and we truly want to make sure that they get the message. And we are hoping that our media partners will help us to disseminate that message, and instead of confusing them. This is something that we have been doing throughout this pandemic. Wherever we have the opportunity to go above and beyond what the province is doing, we have always done that in the interest of our community, to make sure that our community is safe and protected.
Okay, I'm not thinking that we would confuse them. It's just that the timing of these two announcements, seniors may think they have to wait when they don't. I don't know if you understand what I'm saying.
Yeah.
I'm just saying that the timing of the two announcements together.
No.
I know that what you're doing is separate, but from their point of view.
No, and I totally agree. We're even yesterday, as you heard, we've been planning for this strategy for it. Just didn't start yesterday. It started a while ago, and we were trying to figure out how to do this. And so the province's announcement is, it's right on, right in line with we're ready to announce, and then not knowing that. So it's kind of like things are happening and have always changed very quickly through this pandemic. So we're moving forward, and I agree it will be a bit confusing. I do think that we have a great relationship with our media. I think throughout this whole pandemic, I know you're on the line, but I really mean it. We have relied on our media partners to give out the correct information at that time. And you guys, everyone, that's our primary way of communicating to our public. So we will continue to hopefully try to make this a reasonable experience. When the province rolls out theirs, you're right. We'll probably be amending our messaging and figuring out how we better align with what's happening provincially. So, but we will have had 2 weeks ahead of them, and so we'll figure it out. And I think we're trying to use every means to communicate with our public and with our residents. Dr. Ahmed, myself, all of our staff, we get emails, phone calls from many, many people, and they're waiting to hear more. So I hope this will give them a little bit of, an option for the next couple of weeks. And if the province has other options, we always, switch and make that work too and move forward. So we're hoping some of the other provincial conversations that we've had will come to fruition as well, because it just increases access for everybody to get the vaccine, and that's what we want.
Thank you very much.
Any questions from the Windsor Star?
Yes, just to be clear, you want local seniors to use the health units portal. You do not want them to wait. Do you use the province's one when it opens up, or even once the provincial one opens up, to continue using the local portal? Is that correct?
Today, we want everyone over 80 to use our portal, and before, when we have more information about the provincial one, we will make decisions that'll either be continue using our process, because we know we do have a process. However, if the process somehow does not, there's not that clear if the process is they're collecting it and we're collecting it, we don't want that. We don't want a duplicate process, and that may occur. So we'll probably at some point we'll have to say, okay, stop using this. We'll post whatever, whatever website they're using, we'll post it on our website or, the portal, and it'll just bring them to a new portal. So right now they're using our portal, and if we have to swap it out for the provincial one, we'll do that and figure it out. And, obviously I'm not the IT expert. I am not going to pretend I know what I'm talking about. So we will make sure the IT experts and working with the province that we try to align this. But I totally agree. It's a bit confusing, and so be it for now, and we'll get through it.
And then separately, I mean, we could tell that you're very excited about this. Can you talk about how you're feeling, first to be able to launch this registration system, and also to be able to start inoculating the 80 plus age group?
So I'll just start, but we have been doing the 80 plus age group because we've been in the retirement homes and long-term care homes. So that was, that was such a big step for us. And because we do know that they're most vulnerable. Dr. Ahmed has said, a predictor of outcome is your age for COVID. And so beginning with people in the community, and you're all here every day, that there are a lot of community cases, community people that are dying from COVID. And the vaccination, it's proven safe and effective. We want to be able to get it to those groups. Obviously, we all have people that are important in our lives, and I want my mother to have access to this vaccine too. And so I think this is a great news story, and I know it's just the beginning. I know we have a lot of people that need the vaccine, and we've all been, waiting our turn when it's appropriate. So right now, some of our seniors, it'll be their turn, and that is exciting. So we're just happy to be part of it.
No, I don't have anything. I think Teresa captured it very well.
Thank you.
Any additional questions from AMA 100?
Teresa, I guess just at that point, when these individuals at the long-term care home and even your nurses, when they're administering the vaccine, like you said, there's excitement. What kind of reaction have you been getting from your team, or also residents and their families that have communicated with you?
Very positive feedback, and I'd say our nurses, they've always been doing immunizations. I think they feel very privileged to be part of the next step in a global pandemic, and our nurses have worked, and that through all aspects of the pandemic, through case and contact management, which continues, and vaccination, the supports in the schools. All of that is going on in our community all simultaneously, but they are happy to be part of it. I think everyone who receives the vaccine, they understand that this is will change how we all eventually will be able to function again in society. And right now, there's not enough of us that will create that herd immunity. So there's still a lot of time ahead where we have to maintain the public health measures. But I think everyone is both appreciative to be part of this and appreciative to be the recipient of the vaccine. And I know at Windsor Regional Hospital, they have, where they're giving the vaccine, because they have a stationary clinic, that they have a board, and Karen Riddell shared it with us, and they have like thank you notes on the board, and it was pretty amazing to even read what people were saying and how thankful they are. And I know that anyone who gets the vaccine, our seniors, they're going to be thankful. They've, especially in the community, a lot of them, I can only speak for what, I've really sequestered my mom, and I know her friends and family are really adhering to our measures because we want them protected. So yeah, I think we're all happy. I know in the media you've followed us, and I know this is significant.
Thanks, Teresa.
Any additional questions from CTV?
No, thank you.
Thank you, everyone. Have a good day.
Thank you.